Hi, I am Dr. Jagdishan, consultant orthopedic surgeon specialized in knee and shoulder surgery. So what's new in knee replacement? Everybody knows about knee replacement. It's been widely done for osteoarthritis of knee. Today I'm going to explain about unicondylar knee replacement. Otherwise we call it partial knee replacement. So what is partial knee replacement? To make everyone understand, I'm going to explain about the total knee replacement and then I'll come back to the unicondylar knee replacement. So our knee joint has got two joint spaces, one inside and one outside. So if you see the X-ray here, this is almost a normal knee where you can clearly see the joint space is equal, it's well preserved. Everyone knows osteoarthritis means loss of joint cartilage so that the space gets really narrowed and it starts rubbing each other. That's why they all get pain. So this is relatively a normal X-ray. If you see this one, arthritis in the medial side, only the inner side, which is clearly evident by lack of space, and this patient has got a lot of pain only on the inner side of the knee. Whereas this is another patient which has got more severe arthritis, which is very well evident on both sides where there is no joint space at all. You can compare this normal X-ray, the space, and this one. This patient has got only one side arthritis, inner side. This patient has got arthritis on both the sides. So what difference it makes, which I will show in the next X-ray. So this is a patient who's got arthritis only in one half of the knee. So you don't need to have a full knee replacement. So it's enough if you replace only one half of the knee. So this is what this patient had, which we can clearly see. The space which is narrowed here has been rectified here by a partial knee replacement. This side we have not done anything, but the space is still preserved well. So just to explain further, you can see the other patient who had global arthritis in both compartments, inner side and outside, who had a total knee replacement. You can clearly see the difference. This patient had a total knee replacement, whereas the other patient had half knee replacement. Otherwise we call partial knee replacement or unicondylar knee replacement. So what is the difference? This is one of the patient who had total knee on this side. See, the total knee is compared to the partial knee is a bigger operation. So the incision size is definitely big, which usually falls around 12 to 15 centimeter. Whereas this is one of the patient who had partial knee replacement where you can see much smaller incision. So what difference it makes? So definitely smaller incision patient will have far less pain. With painkillers and injections, we can keep the patient virtually pain-free in post-operative period. They all will have much more faster recovery than total knee replacement. So this is one of the patient who had partial knee replacement. You can see the patient is doing movements on the first day itself without much pain. So you can see this is the first post-operative day. The next day after the operation, patient walks with the wheelchair quite comfortably. This is the same patient on the third day, walking even without support quite comfortably. And this is one of the advantage of the partial knee replacement where the patient can sit comfortably on the floor, which you cannot do in total knee replacement. What's the take-home message? Patients who has got arthritis in one half of the knee can very well have a partial total knee replacement instead of a total knee replacement. And the advantages are obviously far less pain in the post-operative period. They all can have much faster recovery and they can go back to work as soon as possible. When compared to total knee replacement, the recovery time for partial knee replacement is far less. Thank you very much.